Hi everybody, it's me. It's your girl Shantae. Still hanging around here. Still very much pregnant. 40 weeks as of yesterday, and still no baby. But you know, I almost just figured that would have been the case. Um, when I did the last video, which I was really hoping that I would have her on my actual due date. Um, Which there's still a possibility that I can because my due date isn't until tomorrow, which is December 11th. But um, I mean, I haven't dilated. I haven't lost my mucus plug. It's just I haven't really done anything. My cervix is not even like close. Like I went to my doctor's appointment on Tuesday, and he told me that my cervix was too far back. So I'm like, what does that mean? I'm like, so she hasn't dropped, or like, what does that mean? So he says that it doesn't look like that I would be delivering on my due date. He said it would be it would be very rare that I would deliver on my due date. So they did go ahead and set me up with a follow-up appointment on this upcoming Tuesday, which will hopefully be the well, it's not hopefully, it's going to be the very last appointment um, that I have while I'm pregnant. So, um, everything with the appointment went fine. My Group B strep test came out negative, and on the other test, they did a HIV and syphilis test, and of course, that came out negative. So, um, which is important. Um, just a side note, I mean, even if you're not pregnant, I would definitely suggest that everyone goes out and gets tested if you are sexually active. If you have, or if you're sleeping with more than one person, definitely I would recommend that you go get tested as soon as possible, especially if you are of the African American descent and you are female. That is very important that you do know your status. Um, just go ahead and put that out there, because I make sure that I practice. Well, obviously I'm pregnant, so I mean I was practicing safe sex the whole time, but like I said, I consider this my miracle child because I was told that I wasn't going to be able to ever have kids, so I am content with this. I take this as a blessing in disguise. So, but anyway, everybody out there, everybody that's watching, please know your status. If you don't know where to go, look it up, find a clinic or something in your local area, ask a doctor or somebody, just get tested. Um, but anyway, back to me. Um, so yeah, I so he checked, no dilation, but I'm thinning out, which is, I mean, I don't really understand that part, not into the whole medical thing. Um, and I always research stuff, but I think I look into stuff too much. So, so I really don't understand how can I be thinned out, but I'm not dilated. So, if anyone knows the answer to that, please let me know because it just didn't really make sense to me. And when he told me that my cervix was too far back, I guess it kind of just slipped my mind that I didn't bother to ask him at that point. Um, but yeah, so he said definitely won't be delivering by my due date, which is December 11th. So my induction they have it set up for the 18th, which is on next Friday, and yeah, my next follow up appointment is on Tuesday, which is the 14th. So hopefully at that point everything will be okay, and we can go ahead and get this show on the road. Um, I am starting to take my nails off, which is going to be very difficult. I'm really going to I want to see how long that's going to last, because I'm the type of person where I've had my nails done literally for more than 5 years. And I mean, I've tried to go without like a few times and take them off. And normally the longest that I've gone is like a week. And it was so hard for me to text. But I mean, whatever. I mean, now I really would have a purpose to actually keep them off, because, of course, I will be breastfeeding, so to be able to put my, like, to do that or whatever on the baby, to make sure that she's getting the suction or whatever. I mean, I don't want to necessarily scratch her or hurt her or anything. So I guess in the meantime, until she's about, I'm going to try to wait until about a month. She's at least a month old before I actually go back and get my nails done again. I might wait and do it when I get home, because the nail shops here suck. Like, all they do is just do like the little tips, and I'm like, I want the like designs and stuff. And when you say you want a design, they put flowers on it. Like, come on, for real? No. Anyway, so yeah, nothing. I haven't had any symptoms, any cravings. My blood pressure was fine, 110/62. Um, I did drop. I lost 3 pounds. Um, yeah, I think it was three. I don't know. And yeah, so I think that he said that may have had a lot to do with me now, with me not working, because when I went for my appointment before, I gained 7 pounds in like 1 week, and that may have had a lot to do with like the fluid and stuff, from because my feet stay swollen up all the time when I was working, and now it doesn't. My feet really haven't been sore, but that's beside the point. She's like moving around really slowly now. Um, they're keeping an eye on her heart rate, because it did drop down just a little, which I was a little concerned about that. But he says that's normal. Um, but just as long as on my next appointment it doesn't drop down too far, then they'll have to do an emergency C-section. So, but that's pretty much it. So hopefully this will be the last video, and